Hello guys, welcome to our YouTube channel. Today we want to speak about hypertension and symptoms of it, and also we'll learn a little how it has affected on our body and how we can avoid it with good lifestyle. So if you are interested to know more about hypertension, please be with us. Hypertension is when the pressure in your blood vessels is too high. It is common but can be serious if not treated. People with high blood pressure may not feel symptoms. The only way to know is to get your blood pressure checked. For risk factors of hypertension, we can say that modifiable risk factors include unhealthy diets, excessive salt consumption, a diet high in saturated fat and trans fats, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, and being overweight or obese. In addition, there are environmental risk factors for hypertension and associated diseases, where air pollution is the most significant. Non-modifiable risk factors include a family history of hypertension, age over 65 years, and coexisting diseases such as diabetes or kidney disease. Most people with hypertension don't feel any symptoms. Very high blood pressure can cause headaches, blurred vision, chest pain, and other symptoms. Checking your blood pressure is the best way to know if you have high blood pressure. If hypertension isn't treated, it can cause other health conditions like kidney disease, heart disease, and stroke. People with very high blood pressure can experience symptoms including severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleeds, abnormal heart rate. If you are experiencing any of these symptoms and a high blood pressure, seek care immediately. The only way to detect hypertension is to have a health professional measure blood pressure. Having blood pressure measured is quick and painless. Although individuals can measure their own blood pressure using automated devices, and evaluation by a heart professional is important for assessment of risk and associated conditions. Lifestyle changes can help lower high blood pressure. These include eating a healthy, low-salt diet, losing weight, being physically active, quitting tobacco. If you have a high blood pressure, your doctor may recommend one or more medicines. Your recommended blood pressure goal may depend on what or other health conditions you have. If your systolic blood pressure is more than 180 millimeters of mercury and your diastolic blood pressure is more than 120 millimeters of mercury, it's hypertensive crisis. If your systolic blood pressure is more than 140 and your diastolic blood pressure is more than 90 millimeters of mercury, it's stage 2 of hypertension. If your systolic blood pressure is between 130 to 139 and your diastolic blood pressure is 80 to 89 millimeters of mercury, it's stage 1 of hypertension. And if your systolic blood pressure is between 120 to 129 and your diastolic blood pressure is less than 80, it's elevated blood pressure. And your systolic normal blood pressure should be less than 120 millimeters of mercury, and your diastolic normal blood pressure should be less than 80 millimeters of mercury. Thank you for being with us until the end of this video. I hope this video helps you to know more about hypertension and it helps you to know about symptoms of it. If you are interested in these kinds of video, please subscribe our channel and see our other videos.